Hello, everyone. Welcome to another amazing edition of Ask NP Deidre with nurse practitioner Deidre out of Ohio. She has a wonderful company and it is called Aspire Wellness Integrative Health. Did I get that right?
You did.
Okay, perfect. Brand new organization. So if you're in Ohio, you definitely have to check it out. She really has the pulse on cardiovascular, vascular care, and combining that with functional medicine. We always talk about supplements, and everyone goes to Dr. Google or Amazon or to their friends or even Facebook advertising. If they know you're talking about vascular or cardiovascular disease, well, certainly Facebook has set up the opportunity for those companies that want to pay a little bit more to better target all of you who are talking about cardiovascular and vascular health. And so they push these supplements to you about cleaning the arteries. And how do you know what's real, what's fact, what's fiction? And so, nurse practitioner Deidre is really our go to with all of these questions. When I said to our social network that nurse practitioner Deidre was going to be talking about supplements today and answering any question that anyone had, we had 17 questions come in about a variety of different things. So, we're going to jump from topic to topic to topic throughout this. So, but first, you know what? I want to ask a general question to you, nurse practitioner Deidre, about you have heart disease. You were on the verge of a heart attack at one point, and I'm curious from your perspective, your experience, what is that number one non-negotiable go-to supplement for your cardiovascular health?
Omega 3s. So, hands down, omega 3s is what I use. I will say my second is turmeric. And because we're reducing inflammation, right? We want to keep inflammation low. And so those are my top two for
And
myself.
I think that that will bring us to one of our questions about, um, I think about omega 3s,
Hmm.
and I am looking for those questions. So she was asking about the difference between omega 3s and plant sterols and krill oil. I mean, how do you sort out what is actually right for you?
Uh, that's a good question there. There's so much like confusing stuff of what is good. I would say there's really great studies on omega-3, especially EPA. Um, that one, the Reduce It study, they had a trial that showed that 25% of there was a reduction by 25% of major cardiovascular events with that. So that's your EPA and DHEA combined, but the EPA only formulas, which name brand, that's Vasipa, that we can usually get through prescriptions. So that would be your superior one that you're um, wanting to get. The plant sterols, those are actually good as well. There's not a lot of studies on those for me to speak of, like are how well are they? But we do know that the plant sterols actually could be good for lowering the LDL cholesterol. And it does that by blocking absorption. So, but if we're wanting to like really look at inflammation, improving that endothelial function and the reduction of triglycerides, you'd want to get into like your EPA, DHA, like omegas that way.
You bring up such a good point, and that's why I was wondering the way she phrased the question, because I look at plant sterols and omega 3s. Those are two very different animals, but I always honor the patient. I ask the question in the way in which they intended it. And I think it's important for that patient, especially, that they understand the distinction between the two. But I do want to reiterate a very key point and even maybe expand on it, even if you do repeat a few things that you just said, because I do want to talk about those plant sterols. When my dad was diagnosed with heart disease, they immediately wanted to put him on a statin, which is standard protocol. Every single PAD and CAD management guideline whether you have high cholesterol or not in a basic lipid panel, that doesn't matter. Guaranteed that even if you do have normal cholesterol in a basic lipid panel, if you get an advanced lipid panel and you have CAD and PAD, guaranteed you're going to have an imbalance in the large, fluffy LDL particles, those bad LDL particles, and the small LDL particles that when they become oxidated by the trans fats and the free radicals and things like that, these small little LDL particles can eke into the damaged areas of the vessel wall, push them out, and do what we consider hardening of the arteries. So, but here's the thing with my dad when he was diagnosed is that we got advanced testing through Boston Heart Diagnostics. And they did what was called a liver production test and then a cholesterol reabsorption test. And it turns out that he didn't have any issues with liver production and overproduction of the cholesterol. He had a cholesterol reabsorption problem. And the way the dietitian described it was that, Captain Bill, you are not pooping enough. I mean, just to be frank, that's what she said to him. And she said that what happens is that when your body, when the HDLs bring the LDLs to be excreted from your body, you're not taking the cue and able to excrete that out all the way out of your body. You're not pooping enough. And so women 1 to 2 times a day, men 2 to 3 times a day. And she said the higher the cholesterol, the higher these mini LDL particles, the more she wants a woman even to poop. So she wants those women with higher numbers to actually have a bowel movement twice a day, men 2 to 3 times a day and more on the 3. And the way in which she suggested doing that was with plant sterols. So my dad has had heart disease for 6 years. He's never been on a statin. And actually his particle numbers are better than mine. And I have not been diagnosed with anything. It's just absolutely crazy. So I really believe in these plant sterols from my experience, but it's something that you should have the conversation with your doctor about. And I'm curious, nurse practitioner Deidre, after this is supposed to be your show, so I apologize. I'm on my soapbox, but your thoughts.
No, I totally agree with what you were saying. I think that's really important. And we know that, like, single-handedly, what you can be doing to improve your cholesterol numbers is fiber, your intake of fiber, right? And fiber is going to cause the pooping as well, but that's really beneficial as well. So your plant sterols, your fiber, reducing inflammation, those are all excellent things that you can be doing in your lifestyle. Sometimes it just feels overwhelming though. And kudos to your dad, because I know he's doing a lot of work to change that. He's really paying attention, and that's what it takes. It takes us to be purposeful and mindful about what we're doing.
And there are different reasons why you might have cholesterol. So it's important. It just because it worked for my dad doesn't mean it'll work for others. It depends on your situation, your presentation of disease, but it's worth asking your doctor for those. And on padhelp.org, I do have a list of the blood tests, which I think include. So if you can't go to Boston Heart Diagnostics, I think I created a blood combination that would demonstrate whether or not your body is actually reabsorbing or not. But most people I have heard from this dietitian, even if they do have a liver production issue or overproduction, they still have a major reabsorption issue. So it's worth just checking into. Okay, are you ready for the speed round here? We have
Let's
quite a
do
few
it.
questions.
Fire.
Okay, fire away. Which supplements are most effective for improving circulation in the legs?
So we already said omega-3s, right? Because it helps with the endothelial function. Your citrus flavonoids, such as diosmin, it helps with chronic venous insufficiency, improves your leg heaviness, swelling, and cramping. L-arginine is a precursor to nitric oxide, and that can help enhance vasodilation. We talk a lot about nitric oxide in several other episodes, so there's going to be this recurring theme of what nitric oxide does to help with the vasodilation. So that's a few to start there.
And since you mentioned L-arginine, how in fact does it work for improving blood flow, and is it safe for everybody?
So it is a precursor to nitric oxide. So what nitric oxide does is enhances vasodilation, so opening up those vessels. Um, you know, it's an amino acid, so you can get it through your foods. I would I would always say with anything, you want to talk to your doctor before you start supplementing if that's safe for you. It really is dependent on other medications you're on and things like that. But overall, if you're getting it through food sources, yes,
We have
fairly.
a question coming in live from KGC about ginkgo biloba. What do you think about that?
So I actually use ginkgo biloba myself for brain health. So I haven't used it a lot in my cardiovascular patients at all or thought of it that way, but I do know like when it comes with cognition, it's really helpful with your B vitamins, but I haven't used it in that way.
Are there any supplements that can help with the symptoms of peripheral artery disease, the poor circulation in the legs because of the blocked arteries, specifically targeting neuropathy and leg cramps?
So with that, your magnesium is probably going to be one of the better ones for that because it helps with the cramping. So typically, one of the magnesiums would be good. Not oxide because it's really poorly absorbed. So I don't know that you'd want to use that, but like a magnesium glycinate, a threonate that crosses the blood-brain barrier. That is where I would kind of start with things if you're having the cramping and I use that a lot in patients with restless leg. And about 65% of us have a deficiency, anyways, in magnesium.
And what about B vitamins for neuropathy?
Uh, yes, 100% on the B vitamin train here. So we know that Metanex is a great prescription brand B vitamin that has a methyl form of B that is studied and it shows improvement in neuropathy pain. So that methyl B vitamin is good. If that's not affordable to you, there are other forms of methyl B vitamins that you can get through trusted sources that can be very impactful for the pain.
Do CoQ10 supplements actually benefit heart health? And if so, how? There is a CoQ10 test. I know that through Boston Heart Diagnostics, they offered it, but I don't know if that's a standard covered under insurance test. Do you?
So I know you can order it. I never know what patients' insurances are going to charge them, but you can order it through your traditional LabCorp, things like that. And CoQ10, yes, it does actually benefit your heart health as well. And it does that by improving the mitochondrial energy production. It reduces oxidative stress, which you spoke about. And then it can lower blood pressure a little bit. But if you're on a statin, you're depleting your CoQ10. So that's something you really need to be utilizing as well. And especially if you're having muscle pain, you need CoQ10.
Oh, that'll help with the muscle pain, the side effect of the statin. Oh, that's really good to know. So if you are on a statin, it's really important. Maybe get your CoQ10 levels checked on a regular basis. I know nurse practitioner Deidre had talked about at one point, if I recall, that if you are with all of your medications, you should have a specific appointment every 6 months to get the blood work to understand any sort of nutrient or mineral deficiencies that might be caused by those medications that you're on, whether they're beta blockers or statins or blood thinners, whatever they might be. Just get your blood checked on a regular basis and have a revisit with your doctor to see, well, do I need to meet with a dietitian or a nutritionist to talk about additional supplementation, or with the doctor themselves about a prescription form such as Metanex or the fish oil that nurse practitioner Deidre has been talking about. How about vitamin E? Is it helpful or harmful for people with circulation issues?
Yeah, so that's a great question. Also, there's some mixed evidence about that. There's the JAMA article that cited if you did high doses of vitamin E, it didn't improve insulin sensitivity or glucose metabolism, and it could increase your risk of having a hemorrhagic stroke. However, if used cautiously and in lower doses, especially, it can be beneficial. So that's when you want to be speaking with your provider about like the actual dosing of vitamin E and if it's right for you. I will say that there are also some studies on the annatto form of vitamin E that and cancer, where it helps improve outcomes with cancer. So,
That's good to know.
mhm.
And you touched on this. We have had shows on magnesium, but I want to honor, of course, the question that came in. Can magnesium supplements help lower blood pressure and improve circulation?
The answer is yes to that. It's a natural calcium channel blocker. It helps relax the blood vessels and it can support your heart rhythm and reducing those leg cramps as well. And the best form for blood pressure and everything is the glycinate.
And what's the difference between prescription niacin and over-the-counter niacin supplements for cholesterol?
Okay, so the prescription is like a controlled release, meaning that it releases throughout the day. It's also anything that's prescription is regulated for potency, right? When you get over the counter, it can be very variable in the quality. You do have a higher risk of flushing or liver toxicity with the over the counter of it, if it's extended release there. Niacin can raise your HDL though, and it can lower triglycerides, but it's actually not first line anymore. With the, it used to be like, let's do niacin. It actually isn't first line due to it limited added benefits over the statins. So that's why they're choosing statins first. But if you're getting the prescription, you know that you're going to get a more regulated for potency.
Are there any supplements that can help heal or prevent varicose veins? Now, with varicose veins, my understanding is that they do indicate, for the most part, an underlying problem. I just had two patients in one day yesterday come to me, and they both are suspected of having May-Thurner's syndrome, where they have compression happening. And where the artery is like compressing, I believe, the vein, and they have to go in and compress they have to go in and stent the vein to hold it open so it's not being compressed. And it's actually, you know, leading to major swelling. And some of the patients have ended up, for a lifetime, one since they were age 10, actually having swelling, and then varicose veins just big, rearing their ugly head more and more over the course of the years, and they become very painful.
Yeah. And I would say with the supplementing to prevent varicose veins and things, there's not a lot of good evidence out there. There's some suggestion that Deosmin and hesperidin can help by supporting the venous circulation, but really not seeing people using a lot of supplementing for varicose veins.
And so if you do have these varicose veins, it's really important to see a vein specialist, not just a superficial vein specialist, the one that just deals with varicose veins. Really important to get that extensive, more comprehensive review. So someone who treats the deeper veins and can do a proper assessment, comprehensive assessment of your entire venous system, getting the leg venous ultrasound for chronic venous insufficiency, and or if that doesn't resolve anything, nothing there, possibly going to the extent, depending on your symptoms, to a venogram, where they go in and they send in what's called intravascular ultrasound, or IVUS, which is a 3D camera using audio waves, and they can get a better picture to see if, for example, you have greater issues such as May-Thurner's, which I've mentioned. So really important.
That's a good like kind of thing to talk about because we see so many people talking about like varicose veins and things in the aesthetic world. It's advertised so much, but there's such a difference there. Sometime we should talk a little deeper into that because what you're saying here, like people who have true disease need to be seen as specialists for this and not in the aesthetic world of
I
looking
think,
at
and
your
I
veins.
exactly, and I think that one of the reasons why it ended up where so many people have come in with just the cosmetic treatment for, varicose veins first is because medicine is a practice. People are learning every single day. And
Mhm.
so many didn't realize they didn't have these grander tests and treatments, and they're not going to have the tests if they don't have the treatments. And the treatments for the grander venous issues have come such a long way, even with clots in the veins and the ability, companies like Anari and Penumbra coming out with some fantastic devices to suck out the clot in your legs. And those have just been really coming out and becoming more widely adopted in recent years. And so people just didn't search for any deeper issues. And so that's why, with the cosmetic, they started there and they weren't getting to the deeper, heart of the issue. But now there's no excuse. If you have these varicose veins, you now are on notice. You need to go get checked. Find someone who is a real vascular specialist, vascular surgeon who can do a deeper dive for you. And gosh, in both these cases where they have the swelling, it's mainly in the May Thurners, it's in the left leg. So you kind of know if he gets real swelling in that left leg and you have the varicose veins, you might want to double check and find a doctor who knows about May Thurners. And I hear they have a great Facebook group with a lot of patients that have really driven the movement in treatments and awareness for May Thurners. So they're worth checking out as well. Um, we talked about this a little bit, but I'm just going to reiterate this as a separate question. Can turmeric curcumin supplements actually reduce inflammation in the blood vessels? And which ones do I need to take or choose?
Okay, so yes, curcumin, turmeric, it helps reduce your CRP, and it's basically pro-inflammatory, or decreases the pro-inflammatory cytokines there. So turmeric with black pepper, so that's that piperine that helps it to be more absorbed, or a liposomal form for absorption would be good. Curcumin is the more active in it. It's only like 5% of the plant. That when you're looking at curcumin, that's a good one to get as well. If it would be helpful, I can actually put my favorites for you guys to look at on my website for
Yes,
people to.
please. What's your
Okay.
website?
AspireWIH.com. And so I have a link to supplements, and I'll put my favorite ones on there that I know are really well, and you can look at them and try to find them.
Yep. And always remember to ask your healthcare provider if these supplements are right for you. Don't act on any advice that is offered here without checking with your healthcare team who knows your medical history best. And do garlic supplements. We haven't talked about garlic supplements. We've talked about the importance of garlic before. Do garlic supplements really thin the blood and improve circulation?
Um, yes, but it has really mild antiplatelet effects, right? Um, it can lower the cholesterol modestly, but you really have to be cautious, especially in people who are on blood thinners. And that needs to be discussed, like definitely medical supervision if you're going to add garlic as an antiplatelet type thing.
And which supplement should be avoided if I'm taking blood thinners like warfarin or aspirin, or I'm going to add on Plavix or Eliquis or Xarelto, turmeric,
Yeah, so when
omega-3.
you're when you're on the blood thinners, so garlic was one of them to be avoiding or really closely monitoring. So you really want to be monitored well. Your providers need to know that you're on these supplements. Vitamin E and high dose is another one. The ginkgo biloba, high dose fish oil, turmeric, ginger, so those supplements actually on those medications need to be monitored more. So I would never tell you to start these supplements unless you've really had that consultation and somebody is going to monitor you.
And like with my dad, when he was on dual blood thinning therapy, they told him to lay off the turmeric and lay off the omegas. But we did for a little bit, but those have such great benefits overall with anti-inflammation. He started his inflammation, his body started going up when he stopped them. So I can tell you that they actually do something because when he stopped those, his CRP actually went up and we had to figure out a way. So we got a reduced version of them, the lower the milligram, on each one of them. And so it helped. But you'll know if your arms are turning colors, you're in deep trouble. So you don't want to, if you're doing that, talk to your doctor and make sure that you can take a safe dose of some of these supplements like omega-3 and the turmeric so that you can still enjoy the anti-inflammatory properties. There are other ways, right? Food is medicine. You might not be getting a packed punch, but there you can eat fish. You can use turmeric and make an anti-inflammatory tea.
Yeah, ginger is really a great thing to be eating as well. It's these cumulative things that we do that can really, our consistency and the cumulative things that we do to reduce inflammation in the body is what's going to provide a good pack a punch for what we're trying to do to prevent any additional cardiovascular disease.
And Marie is asking if she can eat garlic, I think it is. Um, is eating garlic okay on blood thinners? Not supplements, actual garlic.
So I've not had anybody have any issues with eating garlic. I would say it's in most of your Italian dishes. Most it gives a lot of flavor. So unless you're on really high doses and your provider tells you not to eat that, most people, food is medicine, can go ahead and eat the garlic.
And Heinz wondered about beets or beetroot powder for varicose veins. How does beetroot powder actually help your body?
So beetroot is an amazing supplement here. It really helps with vascular as well. So looking at how it just kind of helps improve circulation, cardiovascular overall. I'm a huge fan of beets, beetroot, things like that for its benefits. So yes, it does work.
How about vitamin D supplements? Can they improve vascular health and how much is typically recommended?
So we know that low vitamin D is linked to high blood pressure and arterial stiffness. So most people who are having cardiovascular PAD issues have low vitamin D. So you really want to target, so you want your blood work to be between 40 and 60 of the vitamin D. That's where you want your blood work to look, right? And so most people need somewhere between 1,000 and 4,000 IUs a day based on where they started with their labs to reach that level of 40 to 60, which is optimal.
And what do you think of this is my favorite question. I get this, no joke, at least 1 to 2 times a day. What do you think of alleged artery cleaning products? The patient who sent this in said I looked up the top 10, but I don't know if they actually work.
So, um, yeah, it's a marketing hype. So that's there's not studies that say anything cleans the arteries. Obviously, if we're eating well, we're adding things like garlic, turmeric. We know niacin helps support vascular cell health and everything, but supplementing, there's no supplement that can literally clean your arteries like a statin or lifestyle change. So.
And are there, oh, well, that goes into my next question. I know you covered this just a little bit and you just led into it. Are there supplements that can actually clear cholesterol like a statin?
So most of them can work synergistically with your diet and be helpful, but there are some that actually are studied. So berberine, because it can lower LDL and triglycerides, and it's comparable to statins in some of the studies. Reggie's rice, it's similar to levastatin, so it can be affected. It's not FDA regulated. None of the supplements are, so that's where providers get into this like, well, this is what is studied as the meds, but actually there's some great studies on the berberine and the Reggie's rice, and then we know that the plant sterols can help with reducing LDL. And then psyllium, because you're getting in fiber, it can help reduce your cholesterol when you're using psyllium daily.
And we have just a few more questions here that have come in and been submitted before, but if anyone in our live studio audience, we have just a few that we invited into our live studio audience today. We like to have a few people here to ask questions themselves. Make sure to raise your hand and I will get to them in just a few moments. But first, this one I thought was interesting. This one I'd never gotten before. This patient sent me a study about mitochondrial antioxidant, MitoQ. And it was interesting. It's weird they use the word chronic, but chronic supplementation with a mitochondrial antioxidant or MITO, letter Q, improves vascular function in healthy older adults. Something I hadn't heard before.
So I've actually looked at some of those studies with this, and it's the whole like improving the mitochondria is going to, yes, improve vascular. I don't know specifically that one, but I would love to see that study myself to look at that.
And Hines, go ahead and ask your question.
Hi, nurse practitioner Deidre. I have 3 questions. How do you
Okay.
know the supplements are working as intended?
So a lot of times we base it on looking at your labs. For me, it's like looking at, am I getting a decrease in my CRP? How are my cholesterol levels looking? And then sometimes it's really looking at like your symptoms. Are you improving? Can you walk further? Do you have less inflammation? Things like that. I often do what's called a medical symptom questionnaire. And so I do it before when I treat somebody, and then we add stuff. We look at that again to see if their symptoms are decreasing because some things are not reflective on a lab.
Okay. Second question, how do you know the dosage you should be taking? Is it based on the daily recommended, or take, for example, magnesium? I mean, there's so many milligrams of magnesium out there. How do you know what you're supposed to take?
Right. And so with magnesium, we know anywhere from 200 to 1200 is kind of a sweet spot, and it depends on what we're trying to treat. So if you are looking to treat more like diabetes, for instance, you're looking at a higher dose of the glycinate and things like 6 to 1200. One thing with magnesium, if we're getting too high on magnesium, the side effect to it can be diarrhea, severe GI symptoms. So then you start to back off, you know, you've hit too high for you. But you're right, that is like dependent on which disease we're treating. But in general, 2 to 400 is where people start. But honestly, I think sometimes when people feel that supplements don't work, it's because they aren't getting that therapeutic dose of it, like that for their need is much higher. And it's the same way with like your omegas. Like a lot of time you'll take one out of the jar, but really what you need to improve like circulation and vascular is to be taking like 4 grams of it. So
My last question, you and Kim kind of spoke about it also. It's generally stated and written, talk to your healthcare provider. But who is the healthcare provider that you need to talk to? I mean, anything I take, pill form, be it vitamins or something that some ENT gives me, I run it by my cardiologist, you know, because to me, my pad cure or pad maintenance is more important than anything else, you know? So I just don't want to overlap with anything I'm taking, but you ask these healthcare providers, do they really know?
No, that's true. Not all of them do know. And that's you may have to find somebody who's nuanced in if you're wanting to supplement. Nuanced in that who takes into consideration your cardiovascular health and then works synergistically with that provider as well. We do have some great providers out there that are well versed in it, cardiologists that are endocrinologists that are, but I always say whoever's prescribing you the medications, that's who you want to talk to about it. Like that's who your doctor is. Like whoever's giving you meds for whatever disorder you're having treated, that's who you want to talk to. And they may or may not know the supplement stuff, but maybe you can ask them then who should I talk to in your area or who is well versed if that's the route you're wanting to take.
Excellent. Thank you.
You're welcome.
Fantastic. And our final question is from Douglas. I don't know if Douglas, who is in our live studio audience, wants to come on. This is an awesome question. Douglas, do you want to unmute and ask your question?
Very, 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 very simple question. Is there one simple vitamin I can take daily that kind of covers instead of taking 8 different vitamins? Is there one multivitamin that kind of does the basic of everything you're talking about?
That's really a great question, and unfortunately, there is not. It's multiple things. You know, we say take a good multi for your vitamins and your minerals, but when we're really getting into the nuances of PAD and cardiovascular, there's not a lot of combo things because what's good for one doesn't work with another, and so the answer is no. I'm sorry.
Wow, raining on our parade. And this
I
one I
know.
was really hopeful for. The one thing that you can find, you can find anti-inflammatory combinations from really great providers such as Designs for Health. You want to make sure that if you do choose to find a combination, a lot of times you can find these things that have the ginger and the turmeric and the fish oil all combined, but you want to make sure that it's a really good provider, solid, reputable, that has the clinical studies, right? NP Deidre.
Right. And so sometimes what you'll see is there'll be a combo, but there might not be like the mega might not be 4 grams. And so then you're having to add a little bit more. And so, but they have some, like you said, with the ginger, turmeric, CoQ10, things like that, that are combos. But to talk about all of them with the berberine and the red yeast rice and everything we talked today, there is not one.
No. And that's what's really, disconcerting is, I mean, is there any way that you can break things up? Do you have to take every one of these every single day, or can you, I know like with vitamin D, sometimes you can do that every other day or every few days, according to my primary care doctor, but you have to talk to your doctor to figure out what's best for you. But is it possible with any one of these to skip a day? Because I literally have 13 supplements that I take per day,
Right.
and I would love to break them up.
I try to get people down to minimal supplementing, and really it's like working on the lifestyle and the dietary stuff. But like we are a sick world, right? So there is a need for supplementing and adding things in because I mean, we've talked about regenerative farming. Like there's so many reasons why we're a sick world and why we need to be supplementing. And and so that's an important piece of it. I would say to not overwhelm yourself, work on a few lifestyle things and add just the top 2 or 3 when you're getting started here. Like I can give you the best executed plan of all the supplements we talked about today that I know would work for you and I know would be good for you. But the bottom line is that's too overwhelming for the average person. And 13 is, as you know, a lot, it's a meal. It's a meal of supplements. So I usually start with the 2 or 3 that's going to be the most impactful. Omegas you can get in a liquid form. Your vitamin E can be a liquid form. Some things are powdered. There's ways to kind of take it apart so you're not swallowing a bunch of pills. But I would start with just a few and then work on the lifestyle because that's the most important thing is our lifestyle.
And I know we're over time for this, and you have to run to get to clinic because you have incredible patients that you're working with at Aspire Wellness. So, but I do want to honor a question that just came in that our amazing YouTube producer Joshua got from Yvonne, and I think you and I can team up on this. But I think you can also share from experience. What are the most important questions I should ask my vascular surgeon or vascular specialist on my very first visit? What do I need to know? I have arterial insufficiency. I'm wondering if it's venous insufficiency and arterial. So it could be peripheral vascular disease. So I think we could take venous and arterial a little bit separate. She's already had a couple of angioplasties. So I would imagine that it's blockages in her arteries known as peripheral artery disease. But using the word insufficiency, I automatically, think of venous insufficiency. But I wanted to just go with you first, nurse practitioner Deidre, because also your sister has PAD. And so you can probably even share from experience the important questions to ask.
Yeah, so I think important questions to ask is, well, what can you do lifestyle wise? Knowing where you are in your disease progression and like what are the most impactful things that you can do. So when we say walking, it's not just like this little bit of walking. It's like walking with force to like really have to improve that. So really understanding like what your role is and helping yourself. And then I would say that that's what I would start. How do I reduce inflammation? What are some of the most impactful things I can do for where you are? And how many minutes of that is walking and how forceful does that need to be? That's something I would ask and get information on.
You bring out the two most important points, I think, of any vascular visit. And it's funny because in our studio audience, we do have our friend Marcia, who's also in Ohio, and she is on her treadmill right now watching. And she popped on for a second on video, and I could see she is hoofing it. She is really hoofing it, right, Marcia? Oh, she's taking a deep breath right now. I don't know if she has the breath. There she is. Marcia leading by example. Thank you for making us all look bad.
I just took a break. Yeah, thank you.
Fantastic. Do you have any questions for nurse practitioner Deidre while you're on? Or we covered a lot, didn't we?
We did. You were
Yep.
right. It was speed. It was a speed question today.
It was. And I want to finish up just answering and reiterating what you said about the questions to ask the vascular surgeon. Yes, it does depend on your presentation of disease and your symptoms. If you're in the early stage, in the intermittent claudication stage of peripheral artery disease, where that means you walk, you end up with some cramping, you push through as much as you can till you want to cry, you start to grow those collateral vessels, and then you stop and you rest and then you start again. Like that is what we call the intermittent claudication stage. You do not want a procedure at that point. And so if your doctor is offering a procedure in your intermittent claudication stage, you need to stop for a second. You need to say, hey, doctor, as nurse practitioner Deidre says, what can I do on my own to mitigate my risk factors first naturally? Let's talk about medicine. Let's talk about supplementation, and let's talk about walking. Refer me to a supervised exercise therapy program. Refer me to the Global PAD Association, which has a free structured walking program called My Steps. You can find that at padhelp.org or call our Leg Saver hotline that is on the screen behind me, 1-833-PAD-LEGS, LEGS. And in terms of diet, request a referral to a dietitian or a nutritionist. It's most important. Ask about your risk factors. Why do I have PAD? Because the key is what is damaging my arteries leading to that plaque buildup in my legs. Am I a smoker? I need to quit smoking. Do I have pre-diabetes or diabetes 2 or diabetes 1? Do I need to get my glucose under control? Do I need to go see an endocrinologist? Do I need to see Dr. Michael Danziger if you're in Minnesota, Virginia, New Hampshire, Florida, or Massachusetts? He has a covered diabetes 2 reversal program that is covered under Medicare and Medicare Advantage PPO plans, worth checking into. And in terms of the doctor, if you are in the lifestyle the lifestyle limiting claudication stage, where not early stages of that, where you go to the store and you might have a cramp and you might have to stop. No, we're talking about lifestyle limiting, meaning that you cannot do your job on a daily basis. You cannot care for your family. You cannot do your daily tasks as you need to do because it's taking too long and it's too painful. Well, then you can actually ask about a procedure. But before any procedure, I don't care what procedure it is. I don't care if it's angioplasty or surgical. You always, always, always get a second and even a third opinion to make sure that you have all of the options that are available presented to you, because different doctors, different tools, different techniques, different philosophies. And just because you Dr. Googled them and they have great reviews, just because they were referred by your primary care doctor that plays golf with them and wants to help their golf buddy pay for their golf game, or a friend that may have been treated by them and supposedly they saved their life and limb, supposedly, they think, at least for now, that's not how you want to choose a doctor. You need 100%, your leg is on the line. You need to choose a doctor based on actual skill set and the outcomes from patients. And you can find those through the Global PAD Association. We can train you on the critical questions that you can ask to determine if your vascular specialist is right for you. Every single PAD doctor will tell you they treat PAD, but there's a huge difference between a doctor that treats PAD and a doctor that treats critical limb ischemia, CLI, the most advanced stage of peripheral artery disease. It's a very special group of people that treat that advanced stage. And if you want someone for the long run, you truly want a CLI operator that has the most advanced tools and techniques at their fingertips, if in fact it is medically appropriate. So keep that in mind when you are choosing your doctor. And I can give you some of those questions. If they are going to treat you with angioplasty, do they, come down from the top, with wires and balloons straight from the groin? And if they can't get through, coming down from an antegrade approach, meaning poking the groin and coming down, well, will they poke in the foot and come up from below, at least try to actually tackle the blockage coming up from below? If they can't there, what other options do they have available? Do they have a minimally invasive bypass known as PTAP available to them? Do they have a minimally invasive Hail Mary procedure known as a deep vein arterialization, or DVA, or TAD-V, meaning they can hijack a vein in your ankle and reroute blood flow through a vein in your foot? That's really important. You always have to plan ahead. Do they, if they don't do open surgical or hybrid procedures, do they work with someone who does? So those are just a few of the many questions that I would ask. And I would also key off if they're treating you too early in the intermittent claudication stage, or if they're treating you in the early lifestyle limiting claudication stage, then you do need to just take a step back and go, whoa, that is not the appropriate care either. So lots of questions. You can always call our Leg Saver hotline at 1-833-PAD-LEGS, and you can get more information there. But again, sorry, Nurse Practitioner Deidre, I've been on my soapbox all day long. I just don't know what's gotten into me. Too much coffee this morning, I think.
Yeah, you go get them, Kim.
I love you, Nurse Practitioner Deidre. I appreciate you so much. We're taking next Wednesday off, but we're going to be back the next week. So I think we're going to do another ladies only episode, and we'll figure out what that's going to be. Probably, I have a feeling where we're going to go. There was a LinkedIn post that we both commented on that I think that I am going to follow through with, which could make for a very exciting episode talking about women and sexual health. So you don't want to miss that. Thank you again, nurse practitioner Deidre. Any final thoughts? We appreciate your time so much.
Thank you all.
Make sure you do subscribe to her channel if you want to see more of this great content. NP Deidre, it's youtube.com/@NP Deidre. Check her out on YouTube. Make sure to subscribe. Make sure to like the video. And if you subscribe, you'll get notified every time we have one of these fun episodes. So thank you, everyone, for joining us. And of course, visit our website, Aspire Health, WIH, correct?
AspireWIH.com.
AspireWIH.com. Make sure to check it out, and we'll see you in the next episode.